today's class we will see about gene therapy. Currently the technology is improvised and AI, information technology, many technology has been incorporated in a medical field. That is being used as a robotic surgery and many things they are doing. Same way in gene therapy. Here in this class we are going to see what is gene therapy, what is the aim of gene therapy, why they are doing, what are all the different approaches they are following, and what are all the ethical consideration we have to know as a nurses when you are assisting the gene therapy in the hospital with the doctors, and what is the current trends in it and what is the cost of it we will see. Gene therapy, it is the technique that uses genes to treat or prevent or cure the diseases or the medical disorders. Disease and the disorders, anything that can be correct. Why they believe it? Because genes are carrying the genetical information from the one generation to the another generations. So it has got a positive and also the negative is there. That's why we are talking about eugenics, positive eugenics and negative eugenics. Let us see what is the aim of gene therapy. To treat or prevent the diseases, to modify the person's gene with a healthy one if they have a poor gene like a diseased gene, and to replace the faulty genes and to inactivate the disease causing genes and to introduce the new modified gene into the body. So where the genes are coming from? As I told you, genes are coming from the our four parents. It's passing from the generation, both the parents it's passing. It's in the cells, it's in the form of a chromosomes. In that chromosome, genes are orderly, has been arranged. Gene has got so many works, like gene has having a like a codon, it's activate the codon, it has got a genetic coding material. When it is code, it will be making the proteins, which is it started to making the proteins. What's that information the gene codes will be telling shut down or stop codon, start codons are there. According to that, the cells started to functions and building blocks. Like DNA is a building blocks of the body. When you altered, you are totally altering the DNA if you touch the germ cells. If not somatic cells, we are talking about here mostly somatic cells, we are doing the genetical modification. In this class end we will see why we cannot do it in the germ cells. Is there anyone is breaking the rules? Let us see. Next will be the approaches. As we have seen in the aims, the approach also gene replacement. What is replacement? It is totally replace the faulty gene with the healthy one. Gene inactivation, that is silencing which gene is activated or this gene is very much active. This is the one causing disease or disorder or cancer, making them silent. So they will not, the protein will not be activated or the abnormal cells will not be produced by this thing. Next is a gene addition. So adding the new modified gene in order to make it as a healthy, or in order to achieve the goals to bring the healthy life of the individual. Gene editing. Editing is nothing but it's like turning on and turning off to remove the piece of DNA. Like that we can do it. Okay, how are we going to do? Delivery method. How we are delivering this editing, whatever, how it is reaching our DNA. One is the in vivo and in vivo, ex vivo. In vivo is the delivering the gene directly into the body by using the vectors. What is vector? Like mosquitoes, we have seen vector-borne disease, entomology we are studying. Like that, it's a kind of a modified virus. Through that it will be taking into the into the body. And ex vivo is you will use it in the laboratory method. You will modify them in the lab. Okay, patient cells will be completely modified in the lab. What is the cells they are modifying? Mostly somatic cells. What are all the somatic cells? Let us see later. So what are all the challenges will be there? The main challenge in this, while challenges, and what are all the challenges and how are you going to consider those challenges? And this challenge is mainly by the safety, immune response, how it will be. How you know how you are going to do that. Some suddenly immune response you replace by this, the codon is wrongly activated, our own body may develop some of the immunosuppressive diseases. Still the studies are going on. Then unintended effects, which effect you cannot predict what it will come when you are doing a new invent the new technology and a test with a human being. And the delivery and targeting cells, how you are telling that it will be delivered by the in vitro ex vivo, like that, how it will be deliver the target cells, because cancer is a target cell. Cancer may be not throughout the body, it may be in a particular cells. So how it will go and attack that particular cells, still research is going on. And about the cost and accessibility, how cost is very high unimaginably, and the technology also not widespreadly available, and accessibility everybody cannot access it. Long term effect, what will happen in long term, that still we are studying. Our experience, how it is going, the person who is modified gene, how they are behaving, still the research is going on. Let us see the potential applications. Hemophilia, these are all mainly genetical disorder. Hemophilia, sickle cell anemia, cystic fibrosis, leukemia, sickle cell disease, and Huntington's disease. Some of the cancer treatment is the potential application for this gene therapy. What is the ethical consideration while you are doing this one? So ethics is very important. Afterwards, Nuremberg theory, that strictly followed. Ethics, you have to explain the patient about the safety and informed consent. We are doing this risk is what, benefits is what you have to explain. Justice and equity, you have to do some justice to them. And then gene editing in a human embryo is prohibited, you have to tell them that is prohibited. But I have seen one video recently, Elon Musk is creating his own artificial embryo, where both the couple are going and they can modify. I want the color of my baby is like this, my eye of the baby is blue color, and he should be, then it is prohibited, we are telling. But Elon Musk has released one video, like how we prepare the chicks, at 3 lakhs chicks will be coming within by incubator, like that the babies are 30,000 babies are been incubated. I mean it is cultured or created, I can say, in an artificial womb. It takes around nearly 10 months. They are doing that. I don't know what is the ethical consideration Elon Musk is following. And genetical engineering is against the nature. Every religion is telling Brahma is making, Jesus is the one who giving the life of the individual. There is a evolution theory, many theories are there. It is all against the law of nature. If the human started to create, it will end, the world will end soon. That's what we can say. And eugenics is improve the genetical human race. It advocate the selecting breed and force to sterilization for the defective breeds or undesirable one. That's what in the beginning of class I told, eugenics, positive eugenics and the negative eugenics. Yes. What is the ethical issues in the gene therapy? So many questions will come in our mind. The issues, what is issue? Issue is the item to be considered. There is an issue, you have to consider and do the justice. That's what called ethical issue. What is that? First one, it involves making the changes in the body's basic building blocks. That's a DNA, deoxyribonucleic acid. So there is the gene is arranged, adenine, guanine, cytosine, it is arranged. It is genetical makeup. Who give them? Is it correct or not? Is it ethically right to modify that? That question is coming in our mind. How to distinguish it's a good technique or bad technique? It takes long time to see the effect. What you make it? I told you just before, Elon Musk is making a baby in an artificial womb. To see the effect, I have to wait for 20 years. he is coming in the human category or Rakshasa category, or is what is this gene, what it is make up. It is against law of nature. So we have to wait. Is it good or bad? It is only for the wealthy people because the cost is very high. It is allowed to enhance the basic human traits such as the height, intelligence, and the athletic abilities. It's only allowed for that currently, they are telling. The gene therapy focus on somatic cells such as the bone marrow, blood cells, which cannot done in a germ cells. Or these cells, when you do it in somatic cells, it cannot pass from the one generation to another generation. Only the germ cells through the meiosis, it will be passing from the one generation, but they are telling it is prohibited ethically. But currently Elon Musk is doing that. Okay. If the gene therapy could target the germ cells, that it may pass from generation. Is it possible? Who gave permission if at all they are doing? But actually they are telling we cannot supposed to do. Which country is doing and who gave permission? That is a question. And then germline gene therapy. This is called the germline gene therapy, which may be passing from the one generation to the another generation. Okay, so ethically it is not accepted to create artificial womb. Then there is no point in getting a marriage. So, what is the gene therapy? As a nurse, we have to know clearly about gene because the genes coming from the both parents generations. So we are telling, sometimes my gene, you are very active, your father gene is working, you are showing the qualities of the father. So you don't hit the baby, you are having, you focus on which quality is good, you can activate the gene by telling your positive words. Right or not? No need the technology. The positive word and a positive one, you can make your child and activate the positive genes. Actually, everyone have a positive quality, negative quality. So, automatically the negative qualities will be shut down while rearing the children. No need go for technology. Only positive words cost nothing. Hope you understand. Thank you.